Sydney's COVID outbreak has widened with clusters emerging on the front line. 2 hospitals and an aged care facility are on alert after staff tested positive. 3 workers on the Westconnex project have also returned positive tests. The cases surfaced only hours after the New South Wales Premier ruled out ceasing work on major government projects to reduce mobility. With case numbers plateauing, unease remains with the sustained number of people being in the community while infectious. Despite the concerns, Gladys Berejiklian says the state not witnessing thousands of infections is a win for New South Wales, but has offered no guarantees the lockdown will be lifted at the end of the month.
Information has been sent out by New South Wales Parliament today.
The New South Wales Premier is facing tough questions about her 35-day lockdown.
Sorry, one question at a time. I'll get to all of them. It's not really nice being shouted at, can I say? Thank you.
As the state records 65 new cases. It's a welcome drop in numbers, but it comes with a warning that figure will spike. 28 of those cases had been unknowingly infectious in the community.
Whilst the case numbers are bouncing around, we are seeing a stabilisation. They are not growing exponentially. That tells us that the settings we have in place are having an impact.
Of the new cases, a pregnant woman at Liverpool Hospital, a COVID ward nurse at Westmead, a worker at the Chris O'Brien Lifehouse Cancer Centre had been included in the new cases. That's since been ruled out as a false positive.
What we're working through, like in all situations, is I think I've discussed with you, sometimes there can be just incongruent results, and we just need to work through what it means. We obviously act with the abundance of caution. We do not want to leave any stone unturned when it comes to the Delta variant.
Workplaces remain of concern, particularly in the southwest. 9 cases have been detected at a Greenacre construction site, sending dozens of workers into isolation. The Premier is again under pressure to define who is an essential worker. She's also again dismissing calls to shut down all non-essential retail. Businesses are being asked to contact Service New South Wales if they need clarification about whether they should stay open during lockdown.
You must stay at home and work from home. However, if you cannot do that, you are able to leave home for work. And in those circumstances,
why not tighten that though? The Victoria did it very successfully, and you're saying
no, they didn't. Can I say the following? It's really important that if you can work from home, both the employer and the employee need to respect that. It's in their health orders.
People are showing through the data that they are actually listening and they're doing it. So I think that we need to just allow those orders time to stabilise and to let people to respond. But I think our community is doing a fantastic job. They generally know that they shouldn't be leaving their home because that facilitates the virus moving around.
The Premier is offering no guarantees the lockdown will be lifted at the end of the month.
Will we be opening up or not? Or will we be locking down more, in your personal opinion, from everything you know, all the advice that you have?
It's very dangerous to ask about my personal opinion. It's never about our personal opinion. It should always be based.
What health advice are you getting about the likelihood of opening up on July 30?
The same health advice we provided yesterday and the day before, and I will ask Dr Chant.
Do you expect to be opening up on July 30?
I will ask Dr Chant to... I wish I had a crystal ball. I wish I knew where we'd be in 2 weeks' time, but I do know, and I want to stress this message, I do know that a large component of where we'll be in the next 2 weeks depends on all of us.
Danica DiGiorgio, Sky News, Sydney.
More than a year into this pandemic, around 12 million Australians are back under lockdown as New South Wales and Victorian leaders look to curb coronavirus cases. It's a devastating development, in particular for Victoria, now enduring more than 170 days shut down in total. Last night, the Prime Minister spoke to Paul Murray, where he warned Australians that they cannot expect the virus ever to be eliminated.
In Victoria, they have 18 cases right now, yet they're going to go into a lockdown for 5 days. Does that qualify as last resort?
Well, COVID-19, particularly the Delta variant, tends to be rewriting the rules, and all the way through this pandemic, you know, we've had to try and learn with the new strains and what it means. I mean, ultimately, those decisions will be taken by states and the territories. We have no direct involvement in those decisions. But we've been going through what we've been going through in New South Wales. A few weeks ago, we had that challenge down in Victoria, which thankfully they got on top of. And I think we want to avoid the sort of protracted, lengthy lockdowns that we've seen. So look, Paul, judgment calls have to be made, and my hope is that, now having made that decision, that it will be a very brief one and not an extended one. And the other point I'd make is this, is in New South Wales, the goal is to ensure that you get the cases infectious in the community down to zero, not cases down to zero. You're never going to eliminate this thing. That's not going to happen at any time, anywhere in the world. And so what you've got to manage with this Delta variant, because it does move so quick, he is right about that. Our contact tracers, whether in New South Wales, Victoria, any other place, they've really gone to a whole new level over this past year. But this thing does move faster than the old one, so it's very hard to stay ahead of it.